for the time being, we need to talk about the doctors' strike. It started earlier this morning, junior doctors, a 4-day strike. It's been described as the most disruptive strike in NHS history. They're on the picket line, and we're going to go straight away to the picket line to talk to, he's from the BMA Junior Committee, Arjan Singh. Good morning, Arjan.
Good morning.
How's it going? Are you receiving lots of support from the motorists and the public as they go by? And I know what your answer is going to be. It'll be yes.
It is. We've had a ton of support so far today at the UCLH picket. The support from the public is incredible. The problem that we've got right now is a healthcare crisis, and we're going on strike for our patients, for our profession, and to receive the support is really warming.
Can I ask you, Arjan, why are you and your colleagues demanding 35% when you know full well you haven't got a hope in hell of getting anything like that?
So I think it's important to contextualise this demand into pounds and pence, which is unfortunately the only language the government seems to speak. Our pay restoration demand takes a junior doctor that is on £14 an hour with £100,000 of student debt, who's a first port of call for 200 patients overnight, to £19 an hour. And I think if you were to ask anyone in the City of London, or anywhere in the country for that matter, is £19 an hour a reasonable wage for a doctor at 7 p.m. on a Friday night? I think you'd be hard-pressed to find anyone who disagrees.
Well, I think you're right, Arjan.
Is a credible offer.
Arjan, I supported the nurses. I thought they deserved a pay rise. I supported the ambulance drivers. I thought they deserved a pay rise. But like yourselves, they both made demands that they knew they had no hope of getting. You're not getting 35%. You're going to settle probably in about a month's time, when people will have died, for about 10%. Now, you've all walked out, obviously for a pay rise. As I say, I respect that and I support you. You need a pay rise. I agree with that. But you're also walking out for what you call patient safety. Now, that you've all walked out, there's no patient safety if there are no doctors in the hospital. So you are abrogating patient safety right now, aren't you?
So at the moment, there's consultants and specialty doctors that are standing down for juniors. These are the most experienced doctors in the world. They are the world-class physicians. We meet with NHS England 4 times a day during these strike days, and if they've got any concerns with patient safety or any quality of patient care, there is a mechanism by which they can raise these concerns. The last strike action, they didn't raise any concerns. But we should talk about patient safety on a longer-term perspective.
Well, no, let's talk about it on a short-term perspective. No, Arjan, let's talk about it on a short... Let's talk about it now. How many patients do you estimate will die because of your strike?
What I can tell you...
Well, you want to answer that question?
Due to...
Patients will die because of your strike, won't they?
At the moment, as we've seen with our last set of strikes, there was no impact on patient safety.
Yes or no, Arjan? Will patients die because of your strike? They will, won't they?
There was no impact on patient safety during our first set of strikes. As I said,
there was. Of course there was. There was an impact on patient safety.
There is 500 patients.
Okay.
Every single week, there are 500 patients that die in the NHS needlessly due to a chronically understaffed doctor's rota.
There'll be more this week.
We have a workforce crisis. We have a workforce crisis that can only be solved by retaining doctors, and the only way you can retain doctors is by giving them a credible offer.
Sure.
We've got a mass exodus. We're 9,000 doctors short. 40% of the ones we've got want to leave, and 500 patients, a Boeing jet full of patients, are dying each week in the NHS due to a lack of doctors. And we've been writing to the government before the strike action in August, saying please negotiate with us and we don't have to strike. They didn't respond until February. So that's 6 months of 500 patients a week dying before they even got around the table. And then when Steve Barclay did speak to us the first time, he had no mandate.
Fair enough, Arjan, but I would suggest to you that more patients will die when the doctors aren't in the hospital. That's only logical. But having said that, I wish you well, and let's talk again. That's Dr Arjan Singh, BMA Junior Doctor Committee member.